Um, if a patient has COPD, unfortunately, they're gonna have like an activity intolerance, right? They literally just move a couple steps, they get really tired. So if they're gonna eat, um,
Rest before.
you want to rest before. Yeah, I want to have them rest before. That's good. Um, do you think fluids will help them? When you drink something, what does that do?
Hydrates.
Okay, it hydrates you. But for a person with COPD, what are we concerned about?
Edema.
Aspiration, edema. When we drink, guys, what does our breathing do? It stops. What's the CO2 going to be doing? Do we need any more of that?
No.
No. Okay, so we want to try to refrain from drinking and eating at the same time because it's going to increase the likelihood of somebody retaining more CO2. Does that make sense? Okay, so yeah, you want to have them rest in between. Yeah. What type of meals do we want to give them?
High protein.
High protein, high calorie diets, right? Okay, good. A patient that has COPD, give me two basic hallmark clinical manifestations. I'm sorry, not clinical manifestations, but what are you going to see? What are you going to observe? Barrel chest, and clubbing of the fingers. Now, why does the clubbing of the fingers occur?
Prolonged oxygen.
Yes. So we have limited oxygen supply. Therefore, at the capillary level, it's trying to dilate as much as it can. Mind you, it's very tiny. So over time, it hypertrophies. Okay, it actually gets bigger. So you have the clubbing of the fingers, and you'll usually see it in the distal appendages because that's the last part of the body that gets oxygenation. Does that make sense? For barrel chest, we're always using the accessory muscles. So the muscles and intercostal muscles. Throughout 15 years of COPD, it gets bigger and bigger. Okay. What precipitates COPD?
Smoking.
Smoking. Okay. Please know what precipitates means. Okay, guys. Let's see. You guys all remember what postural drainage is, right?
Yeah.
Okay. Please know what postural drainage is. What happens to the alveolar sacs and the alveolar ducts during emphysema? Rupture, create scar tissue, so the O2 and CO2 exchange is diminished, right? It's decreasing. Okay. What's albuterol? So bronchodilator. Okay, good. You guys know some signs and symptoms, some side effects of bronchodilators?
You use too much to get that rebound effect.
Okay, that's true. But what else?
Also, your heart rate can go up.
Your heart rate can go up. That's something that happens usually with bronchodilators. What you were talking about, Leo, is an adverse reaction. Meaning it's something that we're going to look. If that happens, we got to call a doctor. We got to take him into the hospital. Like, hey, look, this patient got now, the airway's now going to close up again. But if we're talking about side effects, we're talking about something that we expect to happen. Usually the heart rate goes up. They become tachycardic. Does that make sense? Okay. This is your review, by the way. Half of the exam on Tuesday is going to be things that you guys have seen already. Okay? Only about 20 questions or 25 questions will be on COPD. But it's things that, for the most part, we've talked about. What's a PFT again? Pulmonary function test. So if I'm a patient, right, I come in and I came in from El Salvador, I don't speak English, right? So if you're trying to tell me, you're going to try to tell the interpreter to tell me what to do with the PFT. What are you going to tell the interpreter to tell me? How am I going to perform this test? Okay. First I want to hold my breath. On what? Okay. We don't know. I'm from El Salvador, guys. I don't know anything. I don't speak English. You're going to tell the patient to wrap their lips across this the spirometer machine, okay, and to go ahead and take a deep breath, and then to inhale and to exhale forcefully to see how much air we're actually producing. Does that make sense? That's what I'm trying to get at. Okay. You guys know it, but I'm just trying to get a little more specific. When we ask a patient to participate in pursed lip breathing, how do we, this is how we tell them to do it. So if I'm trying to tell Miss Zaira here, I'm gonna ask her to please take in a deep breath through her nose. And to exhale, which way? Yeah, through your mouth. Through your mouth. You're gonna exhale through your mouth, you're gonna pucker out those lips, you're gonna exhale and try to prolong that whole exhalation. And the whole purpose is to get rid of more CO2. You good on that? If a patient's having an if a patient's having an asthma attack, well, how do you think they're going to be feeling? Restless, fatigue, anxiety. Anxiety is pretty big. They're going to feel like they're going to be dying. So, do you think the anxiety is going to make the asthma attack worse or better?
Worse.
Worse. So, what can we do to calm him or her down?
Let them know what to expect.
Breathe.
Okay. Really breathing, that's pretty good. Yeah. Let them know what to expect. What else? Are you going to go away while you go prepare the medication and leave them alone?
Comfort
You're
how?
going to comfort them. You're going to try to be as visible as possible. You're going to stay with them as long as you can. Excuse me?
Don't just slow down, breathe.
Yeah, usually what you want to do is literally stand next to them and say, breathe with me, mimic what I'm doing. And they're going to be like, how the f am I going to mimic what you're doing? I'm dying here, but you try to do it anyway. Okay? What's aminophyllin? It's a medication. Oh, yeah, amino's an acid. Aminophyllin. What's that drug? Aminophyllin. It's really pronounced aminophyllin, but aminophyllin. 'Cause that's too funny.
Can you write it?
Yeah, but I left my markers at home and that marker doesn't work. A-M-I-N-O.
And what?
A-M-I-N-O-P-H-Y. Okay, L-L-I-N-E. Say it again. A-M-I-N-O. What was that?
Some page 401 is.
It's on page 401, guys. I talked about this before, a couple times. I said it's... Alright, how about this? What's it used for? Look up aminophyllin. It's on one page 401. Alright. I heard broncho, so I'm thinking... No.
It says CC or
Bronchodilator, guys. Okay? Somebody read to me what it says about aminophyllin.
You don't want to crush the medication?
What was that?
You don't want to crush the medication?
Well, let's first explore what it's used for.
anxiety, restlessness, insomnia.
What's its action? What does it do?
Calm you.
It's a bronchodilator, guys. Okay. Now understand, and it's important you guys understand this. Okay, if I'm having an asthma attack, you give them aminophyllin, aminophyllin. Okay, you're giving this medication. Now, I have anxiety, right? So you can get, it's going to decrease the anxiety, but through which means? It's going to increase my respiratory system, meaning it's going to dilate my airway so I can breathe in better, therefore my anxiety will decrease. That's what aminophyllin is. Okay? That's a real common medication that's given. Real common medication that's given. Same thing with albuterol. Okay, these medications are given commonly. If I tell you a patient has emphysema or a patient has bronchitis, which patient, now mind you, all these medications, you can give all of these patients the same medication, but which one in particular you're going to give to, which patient are you going to give aminophyllin to? What does it do, guys? What does it do? Dilates the bronchos, right? Someone's having a bronchitis or emphysema. Which one are you going to give them? Which patient are you going to give the aminophyllin to? Bronchitis. Now, yeah, we can give the emphysema as well, the patient, but primarily because of its action, well, what does it do? You're going to give them, give it to the patient with bronchitis. You're going to give it to the patient with asthma. In conjunction with a lot of other medications, we can give it to the patient with emphysema as well to maximize their air intake. But essentially, that's what we're going to do. Does that make sense? So you guys know what aminophyllin is.
Yes.
Okay, you guys know that albuterol increases your heart rate. Okay, what's, yes?
Sorry. Is that what we just talked about? I mean, is that also drop your heart rate?
Yeah, they all have the same type of side effects, guys. Now, what would you want to report? What would you want to report?
Heart rate?
Okay. When you want to report something, guys, is that this isn't supposed to happen. So we talked about tachycardia as a side effect. That's supposed to happen. What are we supposed to report? If the patient suddenly goes, oh man, I have a headache. You want to report that because if your heart rate goes up, what else do you think goes up? Your blood pressure. And if you have a headache now, what are you going to have? Yeah. Intracranial pressure, you could have a bleed, you can have an aneurysm, you can have a stroke. It just depends. Does that make sense? All right. What medications can we give to decrease swelling in the airway? Prednisone, corticosteroids. Good, good, good. What medications can we give to decrease the anxiety of a patient who's extremely tachypnic? Okay? That we also have to watch out for, not give too much of it. Yeah. Okay, which medication? I don't know, sorry. I heard that too, only wait a minute. What medication can we give that will calm the patient down? Okay, it will calm them down, but that we don't want to give too much of because it might depress the respiratory system. Morphine. Oh, well, that one's specifically for anxiety, but that one's not really going to affect the respiratory tract. Okay, the rest, yeah. Yeah, exactly. Morphine, really, we have to be cautious when we give it. But the cool thing about morphine is if you have somebody that's coming in and they're all tachypnic, give a little bit of morphine. Okay, we're going to keep an eye on them, but we'd rather them have a depressed respiratory state right now because they're tachypnic and they're all anxious, because if they're anxious, they're requiring more oxygen and the demand is going up, yet we're not meeting it because we have whatever underlying respiratory disease. Okay. If somebody has cor pulmonale, okay, cor pulmonale. I'm gonna try to ask it from backwards. If somebody has cor pulmonale, what's happening in the lungs?
They're not getting it or something's wrong with it.
Okay.
Using blood after.
Okay, so now that's good. So now if it's not oxygenating adequately, right? What happens to the pressure in the lungs? What? Hold on. What? That's right. Yeah, exactly. See, I like that. You guys didn't hear her, but she said decreases first, and she's like, wait a minute, and then she did this. Oh no, it increases. I want you guys to think like that. I can't teach you that. I mean, I can, but me saying it 15 times still isn't gonna make it stick, you know. But I like that. I want you guys. It's like that. You guys heard of the aha moment? Okay, back in the 90s, in Pasadena, they were sending some satellite, some radio frequencies to space to see for extraterrestrial life and all. It's called SETI, the Search for Extraterrestrial Intelligence. And then, oh no, the wow moment. And then they got a message back in 1997, I think it was. And when they saw it, they're like, that can't be by mistake. That's somebody actually sending us a message back. So they go, wow, like, oh my God, that's amazing. And that usually, so that's what she had. She had like, wow, like it clicked. That's what I want to see. Mind you, that it never happened again, so we don't know what sent us that message. Anyway, but that's what I want to see, guys. I want to see you guys like, oh yeah, that's right. That's right. Okay, so again, with cor pulmonale, what's going to happen to the overall work of the heart?
Take on more load.
It's going to lose. Is it going to perform its average workload? No. Okay. So, how about this? Are we having right-sided or left-sided heart failure?
Right.
Right-sided. Now, if you think about the pathway of the right heart, okay, it's receiving blood from the inferior and the superior vena cava, right? That vena cava, it's receiving other blood from other parts of the body, right? So now, if you have right-sided heart failure, everything's backing up. Where is it going to back up to? A cyclin-dependent edema. What organs are going to be affected? The liver, the kidneys, the spleen, the pancreas, yeah, all those. Okay. See, and that's how I want you guys to think. Okay, I found a test question today, but there will be one day. All right. What is bronchiectasis?
The bronchioles overinflared. dilate so much and never go back if they become too loose. And
That's right. So what happens when they're too loose and they can't constrict again and push the air out? What happens?
you get the air to build it up inside.
Air builds up, you have fluid build up, again, impaired oxygen exchange, okay guys? What happens, guys, if you have mucus buildup there? What type of position are you going to put the patient in to facilitate its evacuation?
No, that one you're talking about, laying down.
Yeah, you're not going to put them in high Fowlers. Although high Fowlers is good because it's going to expand the lungs, right? That's cool. But the problem isn't the expansion. The problem is the fluid is just sitting there, so we're going to put them in partial drainage position.
Which one's the problem?
What was that?
I forgot which one the problem is.
Well, prone would be partial drainage. You can put them prone with a couple of pillows underneath their pelvic area, so it can lift up the angle, and now you have partial drain. You don't want to put the patient like this, because it's going to increase too much pressure to the head. Okay, but you do want to put them for a few minutes in a prone position with a couple of pillows in the midsection, so you can